I'm Bruce Spurlock, a physician and healthcare leader committed to helping decision makers and professionals navigate change with clarity. On Viral Healthcare, we examine some of the ideas and trends that are spreading across healthcare and how to implement them both wisely and sustainably. Now, on this last week's session, we talked about the downsides of choosing or jumping on a trend too early. And I want to really clarify, we are not anti-innovation. We are not about rejecting everything out of hand. We just want to use wisdom and knowledge about when and how and why, and just exactly what we do when we do decide to adopt a new idea, a new innovation, a new trend. So if you heard our webcast that we did earlier, you'll remember that we actually pulled out a couple of key important downsides that are important to understand. The first one is the most obvious one. It's the one that you've already thought about, and that's sort of like the resource costs. What is it going to cost our organization in time and energy and maybe actually capital and other activities that you need to do to be able to really be successful with it? People sort of spend a lot of time on this. You can actually get caught up in analysis paralysis. That's a topic for the future when we want to talk about how much research is enough and how much is just trying to decrease the uncertainty in your own mind or deal with your own risk aversion. But that's a topic for a different time. On our current session, we just talked about the potential downsides. That's one that people pretty much get down pretty well, but it can be surprising to think about what potential resources you could forego by actually spending time on an innovation. The next one we talked about is initiative fatigue, and this is real. I don't know if you've ever talked about this with people that are implementing on the front lines in the organization. They can poop out. They can get tired of actually implementing interventions, and especially if they're ones that they have no sort of buy-in for, no agreement, or what we like to use the word engagement. We think engagement is super critical to be successful on implementing these kinds of new ideas, new innovations. And if you've got initiative fatigue, it's really difficult to engage people. They show up to meetings, but they're just not all there. The energy level is not the same. So that's a big one, was initiative fatigue. The next one is kind of more subtle. It's something that emerges over time. It's leadership credibility. I mean, if you start taking on and getting exciting about every new thing that's happening, people just won't believe it. They're just going to think this is flavor of the week or flavor of the month, and that you don't really have the ability to discern really effective, useful ones from ones that sound kind of important and tempting and exciting and inviting, but that really probably need to either be done later or not at all. So leadership credibility is an important one to think about. That's one of those ones that kind of creeps up at you. And if you've got upward mobility, if one of your goals is to proceed higher in your organization and another, you can damage it by jumping on too early. And again, I think you can also accelerate it by doing a good job with a new idea and innovation. People really trust you then. So it works both ways, this idea of leadership credibility. Another one is cultural whiplash. I mean, people think the organization is jumping here and then jumping there, and it's just impossible to figure out what really is our organization all about. Who and what do we value? What are our priorities? And what do we really stand for when it comes to improving healthcare? Everybody knows we have to do something. Everybody knows the system isn't working perfectly or has a lot of room for improvement. Everybody knows there's broken parts about healthcare all the time. Just talk to the people in the front lines. They'll tell you exactly what's broken and where they think the harm and the errors are going to come that hurt patients and families in the process. It's cultural whiplash. The one, though, that I'd like to sort of conclude on is this notion of quiet damage. Quiet damage is where people just start not liking innovation at all. They get so tired of seeing things fail. They get so tired of sort of getting excited about it, potentially getting engaged in what you're trying to do, and then it doesn't go anywhere. Or worse, like something replaces it because you're not being that successful, and you don't even acknowledge it in the process. So that's when skepticism about innovation sets in. That's why people that get older, they've seen a lot of failure, and that's why they tend to be more skeptical or curmudgeonly as they age. It's not because they don't believe in it. They've just seen so many times that people overpromise and underdeliver. So if you're thinking about your organization, ask this question: are we doing something because it's right for our organization, or it's just right for this moment? Is it something we've been attracted to for potentially the reasons of velocity that we talked about last time, or authority, or something else that people have gotten excited about this? Or is it because we deeply understand both this initiative, this idea, this intervention, and our organization? That's the question to ask. So that's my weekly reflection. On our next session, next week, we're going to talk about a real innovation that sort of surprisingly emerged. It was kind of neat to see it evolve over time when there was a lot of skepticism about whether it would last, and it was highly sustainable. And we're going to explore exactly why that is. So until the next time, I'm Bruce Spurlock, and I'll see you on Viral Healthcare.